interesting topic for today's discussion is differences between infant and adult larynx. So in pediatric age group, the tongue, which is right in front of or above the larynx, we can call it really large, whereas in adult it is of normal size. Epiglottis is also large and it is floppy, thereby it folds on itself forming omega shape. Whereas in adult, the epiglottis is really firm and flatter and it sticks on to the posterior aspect of the tongue. The level of the epiglottis is higher, that is C3 and C4 vertebra in pediatric, whereas in adult it is C5 to C6. Trachea is as such smaller and shorter in pediatrics, as we know the neck is really short in child, so what it's wider and longer in adult. So the compression of trachea is much easier in pediatric when compared to adult because of this reason. Larynx, oral larynx, it is if you see this, yeah, it's almost the laryngeal outlet, you can make out it's like a cylindrical in adult, whereas in child it's funnel shape. The laryngeal cavity is like a funnel shape. So especially the infraglottic portion can easily get compressed because of this reason. Okay, so the larynx shape in adult it is cylindrical or like a column, and in pediatric it is funnel shape. The position of the larynx, it is more angulated and posteriorly placed away from the glottis, whereas in adult it is straight and it is vertically placed downwards. It is not angulated. So chances of the larynx getting compressed in pediatric are much higher than when compared to adult. The narrowest portion within the larynx, I already told you, it is not the glottic portion, not the supraglottic, but the infraglottic portion in pediatric age group, because the entire laryngeal cavity is like a funnel shape. Whereas in adult, the narrowest portion will be there where the vocal cords are present, because at rima glottis, the vocal cord are two shelf-like projection within the inner surface of the thyroid angle. So this area is the narrowest portion in the adult, the glottic portion. The volume of the lung in pediatric is really low, it's just 250 ml at birth, but in adult we know that it's 6 liters, that is the vital capacity of the lung. So the amount of time the child can speak is really less when compared to that of an adult who can speak continuously, right? That's because of the higher lung volume. So main difference include the tongue is large, epiglottis is floppy and omega shape, epiglottis level is much higher, C3, C4 vertebra, trachea is smaller and shorter. The laryngeal shape overall is funnel shape, so infraglottic or subglottic portion becomes the narrowest portion, and position it is angulated towards away from the glottis and more posteriorly, and the lung volume is low, 250 ml at birth. Whereas in adult, the tongue is of normal size, epiglottis is firmer and flatter, the level of epiglottis is lower, C5, C6 vertebra, and the trachea is wider and longer, so compression is rare. The shape of the larynx is cylindrical or column shape, and the position is more straight and downwards without any inclination or angulation, and the narrowest portion is rima glottis or at the level of vocal cord, and lung has got really high volume, approximately 6,000, 5 liters to 6 liters. Okay, so this is about the difference between infant larynx and adult larynx. Thank you for watching and learning from Logic Medico. If you gain information from this video, kindly subscribe to our channel and don't forget to press the like button. Share the videos with your friends too. Thank you once again for learning from Logic Medico.